Hi, I'm Dr. Jamie Seaman, a board-certified obstetrician and gynecologist, and I want to talk to you about the role of estrogen in our cardiovascular system, which is equally important for both men and women. So estrogen is a primary female sex hormone, but men have it too. And it has a significant influence on our cardiovascular system. One of the most important roles of estrogen is maintaining the health and the flexibility of our blood vessels. So estrogen promotes the production of something called nitric oxide, which is in the endothelium, the inner lining of blood vessels, and it helps the blood vessels relax and dilate. This dilation effect improves blood flow and it reduces your blood pressure. In premenopause in women, this contributes to a generally lower risk of things like high blood pressure or hypertension and atherosclerosis compared to men of the same age. But beyond its effects on the blood vessels, estrogen also has a favorable impact on our cholesterol and lipids, and I did a previous video on this. It tends to increase levels of HDL cholesterol, or the quote-unquote good cholesterol, and it lowers levels of LDL cholesterol and lipoprotein A, which are both associated with that plaque buildup within the arteries. And I did a video on menopause and cholesterol and talked about why those things change after menopause. This lipid regulating property of estrogen helps protect against cardiovascular disease, which is why our risk increases after menopause when estrogen changes. Estrogen's influence also changes the structure of our heart and our blood vessels themselves. It has antioxidant, anti-inflammatory properties that reduce vascular injury and the progression of plaque formation as well. It can inhibit, in the lining of the vessel, there is something called smooth muscle cells, and it can change the proliferation in those artery walls, which reduces the risk of those atherosclerotic changes. In the heart muscle itself, estrogen modulates calcium handling and mitochondrial function, which can support how our heart contracts and uses energy. However, everything I've talked about, these protective cardiovascular effects tend to diminish after menopause, when our estrogen levels drop pretty sharply. And this change partly explains why postmenopausal women can experience all of a sudden your blood pressure is going up and your risk of cardiovascular disease is going up. Hormone replacement therapy can, in some cases, restore some of estrogen's beneficial effects, but it has to be approached very carefully. It can also carry risks. The timing, the dose, your individual health status all matter. But overall, estrogen plays a really important role in our cardiovascular system through multiple different pathways, the way that it changes our physiology. The more you know.